Hi everyone, welcome to Smart Health on Wednesday afternoon here at GoLocal Live. I'd like to welcome on my guest, Dr. Carly Goldstein. Thank you for coming on today.
Thank you so much.
I appreciate it. Assistant Professor of Psychiatry and Human Behavior at the Warren Alpert Medical School at Brown University. Also with the Weight Control and Diabetes Research Center at Miriam. So you're pretty busy.
I am, yeah, these days.
So let's talk a little bit about weight loss, weight maintenance, your focus area. So Smart Health being in conjunction with the Warren Alpert Medical School, I really would like to just introduce you to folks. Since coming to the school, talk about your areas of research.
Yeah, absolutely. So I came to Brown about 5 years ago or so, and I am really fortunate because all of the things that I really love to study are all things that are tremendous strengths of the Miriam and Lifespan. So a lot of my work focuses on using technology to help people change their health behaviors. I'm actually really interested in working on that in people who are attending cardiac rehab. So maybe after they've had a heart attack or something, they go to this program, it's 3 times a week, and they learn how to change their health behaviors, you know, get a healthier lifestyle and everything. What's actually really amazing is that the Miriam's program is one of the best programs in the nation, and it serves as a model program for other ones as well. So I'm really interested in combining that tech interest, so using technology to help people change their behavior, with folks who are participating in cardiac rehab because they have so much going on, and at that point the stakes are kind of high. They already have like heart disease or they've had an event, and so it's really imperative for them to start changing their behaviors to ensure their health going forward.
So let's talk a little bit about that. As you said, a unique population with high needs. Where is the technology there? So you talk about the tools to help them. What are these types of tools? What are they measuring, and how are they providing that information to the patient and the doctor to say, here's how we're going to put you down the right path?
Yeah, so what I think is really interesting is I haven't been at this for all that long, but back when I started about 10 years ago, we did a study with heart failure patients trying to improve their medication adherence, and we actually had to purchase our own iPhones and the data plans and give them to everybody because nobody had their own smartphone. Now that's obviously not the case, and sometimes when people hear me talk about cardiac rehab, they kind of think about older adults, so people over the age of 65. But what's actually really fascinating is that regardless of whether you're looking at older adults or middle-aged adults, smartphone ownership is really, really high across all groups, reaching even saturation in younger adults. So what's really neat is that these folks already have smartphones. Some of them even have things like Fitbits or Apple Watches, and many of them are hooked up to the patient portals, and so they're kind of familiar with using technology for their health. What's great too is that people are really motivated to do this. So obviously people in this situation are really concerned about their health going forward, and they want to use every tool available to them, including time that they're not actually with their doctor, to improve their health. So a lot of people have downloaded those commercially available fitness trackers or calorie counters. The really important thing I think for people to know about those is that there have been some studies that actually look at those apps and determine how many empirically supported techniques are actually incorporated into those apps. The numbers are shockingly terrible. So most apps, they're pretty good for self-monitoring. So, if you were to use an app to track how many calories you were eating at breakfast, lunch, and dinner, it does a great job with that. Some apps even have reminders now that you can customize, for example, to remind you to eat if your blood sugar is getting low, that kind of thing. But otherwise, patients actually notice that when they come to our center, the Weight Control and Diabetes Research Center, they notice that our programs have a lot more to them than just the commercial apps that are available. So what we're doing at this point is we are building from the ground up entire interventions that are all electronic based, so that patients don't have to come and spend 1 million hours a week with us, but they're still getting the services that they need so that they can improve their health. So right now, I think it's a lot of stuff that we're building, but patients are also making use of a lot of commercially available trackers and smartphone apps.
And so we had the opportunity to chat before coming on the show about where things are going in the area of weight loss management research, especially for, as you said, cardiac patients and those with diabetes. Sensors. Let's talk a little bit about the role that they could potentially play. So we're talking right now, of course, about the electronic monitoring, being able to provide it, as you said, to the smartphone. But sensor seems like it would take it up like exponentially.
Absolutely. And our smartphones and our watches and whatnot, they already incorporate some sensors. So some of this integration is beginning to happen. What doesn't really happen is, right now the sensors can only make use of so much data in so many ways.
Mm-hmm.
And so the information that patients are getting back from that is not particularly tailored and may only be useful to a certain extent. So in the future, I think we're both going to have more sensors, which could mean a wide variety of things, but we're also going to get more sophisticated feedback that's being tailored. And then the key thing that we all care about is just-in-time adaptive interventions. So actually getting this information to patients either in the moment that they need it or the moment right before they're going to need it. Okay. So let's say there's a sensor on your refrigerator and you're trying to not overeat at night. Perhaps when you open your fridge past a certain time, your phone texts you to say, hey, do you need anything right now? Like, are you okay? Do you need to talk to someone? Or do you need help making a healthy food choice at this point? So it's kind of that integration and that personalization that's definitely on the horizon.
That's very good. You talk about practical applications. One of the features from the Warren Alpert Medical School recently highlighting your work, very applicable to here in Rhode Island. And it was talking about looking at how to incorporate your favorite Rhode Island foods into a healthy diet. Now, touching upon calamari, lobster rolls, everything from stuffies to chocolate cake. Things that folks want to enjoy, but you have a very practical approach kind of for each of these. So talk with us a little bit how you took a look and gave your advice.
Yeah. So it depends a lot on someone's individual health goals. So for some people, it's really focused on just losing weight, or for some people, maybe they're not interested in weight loss. They just want to maintain their weight and prevent weight regain or gain beyond where they are now. Other people, it's a combination of that with carbohydrates because they have diabetes or salt because they have heart disease. So I would definitely advise anyone to check with a registered dietitian or your healthcare provider to determine exactly what goals are most important to you right now. But otherwise, once you kind of have that outlined, I think of enjoying food as kind of like making a financial budget. So you probably need to pay your rent first, right? And your utilities. So for me, that would be things like fruits and vegetables, lean protein, whole grains. Ideally, you have a little bit of wiggle room in your budget and maybe even some spending money. And so I would never tell someone to not indulge and enjoy. And I'm actually fairly new to Rhode Island, and I love Rhode Island so much. And I love the awesome food culture and all the foods that are available here. And I would say that one strength of Rhode Island is that a lot of the foods are actually quite protein rich. So, we have
seafood,
tons of
oysters,
amazing
clams,
seafood. Exactly. And we have a lot of really creative chefs in Providence who aren't just relying on only a plate of carbs kind of to get you full. So I would tell people to actually look up the number of calories before you eat the thing. And that's a really hard thing for a lot of people.
So make that informed decision.
Yeah.
So don't go into it blind saying, I really want that piece of chocolate cake, but I do know that that's probably about 700 calories.
Right. Probably more like 1,700 calories for a lot of our local favorites.
And have a little slice, yes.
Yeah, so maybe that means when you go to even order your entree, you say to your friend with you, I'm definitely having some chocolate cake tonight. I'm either going to split it in half and take half home, or would you be interested in sharing with me? Any sorts of tactics like that are really, really important for making sure that you're making good health choices.
And so let's talk a little bit about kind of that broader look as well. Lots of buzzwords, kind of trends in the weight loss industry as well. Let's talk restrictive diets, if you will. Of course, we've seen throughout the years, whether it was the fat-free phase in the 90s, and looking right now at the keto diet. Clearly, it's a buzzword. You see people have success in that as well. What's your take on these types of specific, narrow looking diets?
Yeah, the best diet is the one that you can probably continue for a long time and that you can adhere to the best. For some people, that is keto. For some people, it's something else. And so, I would definitely advise you to look at the literature, examine what is heart healthy. I'm obviously biased, but I do think you should prioritize your heart because you're not going to get very far without it. But, any diet that is pretty well-rounded is probably going to serve you well. If you are someone who's considering a restrictive diet, I do have the opportunity to talk to a lot of people who are interested in such things, and I kind of get into a conversation with them about, why is it that you feel the need to cut out certain food groups? And what we find when we talk to people is sometimes they talk about this really strong pull to have certain foods like carbs or whatnot, and they find themselves feeling really out of control, and it's really hard to pursue your health goals when you feel that way. So that would be a great thing to bring up to a healthcare provider, because more often than not, we've learned things in our lives that make us have one relationship or another with food, and sometimes that is worthy of some attention in and of itself.
So speaking of the keto diet, you talk about keeping that real attention to the heart and the cardiovascular health of an individual. Are things like fat, saturated fat, cholesterol, things that have to be considered specifically in terms of heart health?
Yeah, I would definitely say that the macronutrient content, so things like fat and protein and carbs, given your current health situation as well as your health goals, those might be less relevant for you to be considering. But we do generally know that a diet, for example, high in trans fats, is really unhealthy, and so most restaurants even have stopped using trans fats. In general, more saturated fats does appear to be associated with maybe poor cardiovascular outcomes. But to be fair, nutrition research and behavioral research is messy. It's a lot harder than working with mice who you can contain in a certain way. And so there are all these different factors that influence your outcomes, and then some factors we can't even measure. So according to what we know right now, an overall well-balanced diet is probably the best bet. But, let's say you do want to take less carbs in or whatever, those are definitely things that you can play around with very safely.
And finally, too, let's talk a little bit intermittent fasting. Does that fall into the realm of, again, if it's something you can continue to incorporate in a diet long term, is it helpful? And again, does it depend on the individual?
I think it really does depend on the individual. That's kind of the frustrating thing about this research and about this line of work. I totally have empathy for the fact that most people want some sort of cure-all or an answer with food. And, psychologists are famous for saying, well, it depends, as our answers to everything. But, in some cases I've heard of people using intermittent fasting and really learning a lot from it, learning about like what their body craves and when, and then they can take that information going forward. Other people do find that they feel like a pull that they can't resist towards certain types of food, and so then they try to use intermittent fasting to help with that. We know from exposure principles, like if you were scared of dogs, I wouldn't tell you to never see a dog. I would tell you to work up to seeing dogs more and more until the point that you're not scared. The same really applies for food, and food that you feel like you don't have as much control around. So in general, I'm biased. I do think that, an overall well-rounded diet is the best, but there's certainly something to learn from everything.
Okay, and since joining the Warren Alpert Medical School at Brown University, of course, you spoke so highly about joining the team and the areas of research that you are so excited to be part of. Here we are, it's the summer of 2019. You talked a little bit about the role sensors would play. Let's talk about what you're excited in the coming months to be taking part from a research perspective, again, at the Alpert Medical School.
Yeah, so there's a lot going on right now. I'm also really interested in this new way of doing research. So generally, you think about doing research as like a randomized controlled trial where you test one thing versus another. So for example, you could test, does chemo plus standing on your head for an hour a day do better than nothing for treating cancer? Unfortunately, what you'd learn from that treatment or that experiment is that chemo plus standing on your head for an hour a day is better than nothing. But in reality, standing on your head for an hour a day is probably terrible for you. So I'm doing this new type of research called the multi-phase optimization strategy, which basically helps us as behavioral scientists break down the individual parts of the intervention to determine which is actually useful. And this has a lot of reasons why it's a really important thing to do. One thing is that we have extraordinarily giving and considerate patients who are willing to be in our studies. And we are very mindful of the fact that losing weight is kind of a full-time job. And we want to be very sensitive to people's time. So the multi-phase optimization strategy is actually one way that we can both test the important parts of the intervention to find the right combination, but also to make sure that we're not giving people unnecessary things to do. So I'm working on a study of that in cardiac rehab. We just had a study funded working on that in primary care. I'm working with RIPIC, a local organization that does primary care. to get weight loss out into primary care clinics. So there's a lot of really exciting things coming up.
Well, hopefully we'll have the opportunity to have you back on Smart Health to talk a little bit more, but appreciate your coming in, telling us about the latest in research and practical applications from the Warren Alpert Medical School at Brown, as well as the Weight Control and Diabetes Research Center at Merriam. So Dr. Carly Goldstein, thank you so much for taking the time to come in.
Great to meet you.
And thank you for watching the Smart Health segment of Go Local Live, but don't go anywhere. We're going to be right back shortly with Lieutenant Governor Dan McKee.